Welcome to Marian Ayurveda. In this episode, we are going to think about a condition called sleep apnea. Sleep apnea is a condition that is increasing significantly in this era. In this episode, we are going to discuss its various causes, the Ayurvedic treatments for it, whether it can be managed through Ayurveda, and whether these Ayurvedic treatments are effective. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. Those who suffer from the condition called sleep apnea know it quite clearly to some extent. Or for those who don't know, I will explain it. During sleep, while they are sleeping, they stop getting breath. They are unable to breathe. When they can't breathe, this patient wakes up with a start like someone who has fallen into water. They wake up in a panic. That's what happens. Because of that, they only sleep for a little while, maybe an hour or an hour and a half. By then, they can't breathe and they wake up with a start. They go back into a deep sleep for a while and then wake up with a start again. Like that, they wake up with a start 3 or 4 times during their sleep. So because of that, their sleep doesn't become proper. Often this waking up with a start is identified by the person sleeping next to them, like a life partner or someone sharing the bed. Similarly, the symptoms this person shows include excessive snoring. This person will exhibit very loud snoring sounds. The difficulties this patient experiences are really due to not getting enough oxygen supply because they aren't breathing properly and oxygen isn't reaching the body. When they wake up, they won't feel that sense of freshness from having slept. Similarly, there can be headaches, daytime sleeping, that is a tendency to sleep during the day, or falling asleep while driving. Sleep apnea is a condition that negatively impacts daily life in such a way. Why does this condition called sleep apnea occur? If we look at its pathophysiology or the cause of the disease, it is said that any blockage in the airways can cause sleep apnea. So this happens in 2 ways. One, physical obstructions in our airways can cause this condition. By physical obstructions, we mean things like nasal polyps in the nose. These nasal polyps swell up and completely block the nose. Along with that, if a cold or something comes, it gets completely blocked and one might have difficulty breathing. Or the adenoids might be enlarged. With enlarged adenoids, many people might experience breathing difficulties, or the tonsils might be enlarged. Commonly in patients with what is called sleep apnea, their soft palate or upper palate. This upper palate is the part that separates the nose and the throat, while the mouth, it's a part like a wall. This should normally be raised. When this hangs down loosely and closes, that's when they experience airway obstruction. That is, in this airway, the path from the nose to the lungs, when this upper palate comes and blocks it, that's when this condition called sleep apnea is commonly seen. Similarly, all the other reasons mentioned earlier also contribute to this. Likewise, excess fat in the neck area. That is, in some individuals, the neck might be very thick, or obesity itself. The accumulation of a lot of fat, which causes the airway in the neck to become very narrow, all contributes to this sleep apnea. That is, sleep apnea caused by physical obstruction. A second reason is related to the brain. The reason related to the brain is defects in signaling. If there is a defect in the signaling coming from the brain, sleep apnea can occur in the same way. So the treatment for both of these requires very different approaches. So as I mentioned earlier, obstructions in the nose or other obstructions in the throat, all of these can cause sleep apnea. Mainly, we can see this occurring in 2 ways. One is a type of sleep apnea caused by the accumulation of fat or phlegm due to excessive consumption of fat, or things like nuts, tapioca, or other fatty foods. And the second type is one that can occur even in very thin people. It can occur in people who don't have any thickness in their neck. There is also a type of sleep apnea caused by acidity. That is, in these individuals, acidity increases. And a reason I have always found in people with high acidity is that when acidity increases, our valves weaken. Or instead of our upper palate staying strong as it should, it weakens and causes airway obstruction in this way in thin people or those with acidity, which is what we observe. So for what reason are we seeing this? Sometimes it might just be nasal polyps. So with nasal drops or other medications, we can shrink these nasal polyps, or we can even shrink adenoids using medication. So once we identify the cause and provide the appropriate treatment, this sleep apnea, actually a patient came to me recently. When I examined this patient, they had sleep apnea, their sleep was disturbed, they were sleepy all day, and they work at a bank. So there are many such problems. So they saw a pulmonologist, they did a sleep test, and it showed oxygen deficiency in the brain, meaning because the oxygen, the blow airway is blocked, enough oxygen isn't reaching the brain. Because of that, they suggested using machines like CPAP and sleeping with an oxygen mask. Anyway, the patient came to our clinic for a second opinion to see if anything could be done in Ayurveda. I have already treated many patients in this field who have recovered after taking the medicine. Based on that clinical experience for this individual as well, the main issue was acidity. More than the blockage caused by phlegm, there was an issue of obesity. More than that, the problem this person had was acidity. So when we gave medicine to treat the acidity in this person, once the acidity was gone, the organs in the body became very firm and strong. That is, as I mentioned earlier, this airway obstruction happens because the organs in the throat, like the soft palate, become loose. So when the acidity was treated in this person, the airway obstruction also resolved, and now this person is able to sleep comfortably without any issues, without needing those machines that help with sleeping, and without an oxygen mask, which they had been using for so long. So this is what I feel from the patients I have seen. About 80% of those suffering from sleep apnea have acidity as the cause, as everyone generally has a lifestyle that can cause acidity. So for such people, if I may say, if it is due to phlegm, if you feel that you have excess phlegm, then patients like this should be careful to avoid things like nuts. What else? If you have a habit of eating deep fried foods, excessive chicken or boiled eggs, and you have a phlegmatic constitution, you should avoid those. If acidity is the problem, you should reduce the excessive use of things like tea and coffee and reduce spicy and sour foods. These are the things you need to do. Similarly, if it is due to a brain disorder or if it is due to problems in signaling, we use medicines to correct the nerves and the nerve signals. That is something we need to correct by seeing a doctor, because those are very rare. Sleep apnea is, it is a condition caused by problems in the abdomen or, underlying issues. So I feel that in Ayurveda, based on the response we have received from a few people, sleep apnea is a condition where we get results very quickly. So we will see you again with another episode. Thanks.